You are developing a district plan to address low coverage rates, an issue that has also been identified in your EPI program strategic plan. A key part of this plan's success will be communication with the communities you are trying to reach. How do you go about developing a communication plan? Planning for communication activities is an integral part of any immunization planning process. While a communication plan is often developed by a communications specialist, as a district or subnational manager, you should work closely with this person to select areas for communication and identify useful strategies. There are different types of communication plans, but any plan should be developed using the same overall process. Analyze the current situation, set specific objectives that you hope to achieve, identify strategies and actions for reaching those objectives, choose indicators to measure progress towards your objectives, identify resources to implement these strategies, and finally, develop a detailed plan with actions to carry out these strategies. Let us look more closely at each step. The first step is to analyze the current situation. During this step, you are asking, what existing problems can be improved by communication? Or, what are some problems you might anticipate for planned activities such as vaccine campaigns or the introduction of a new vaccine? Begin by looking at immunization data to identify areas with low coverage or high dropout rates. Then identify barriers to immunization in these areas. Be sure to consider service delivery issues such as cancelled sessions or vaccine stockouts. Then look for issues with demand. Try to understand the awareness and opinions of community members around immunization services. It may help to review or conduct knowledge, attitudes, and practices or KAP surveys. Gather information directly from the community through household surveys, community meetings, and by working with community and religious leaders. As you identify barriers to immunization, look for underlying causes and problems that communication can address. The next step is to set specific objectives for your communication plan. Ask, what are we trying to achieve? Say your analysis identified communities where caregivers are not aware of services. One objective of your communications plan might be to improve outreach and education to these community members. For each objective, set realistic targets. If an objective is to improve outreach, a target could be to hold a community meeting every 2 months in villages with low immunization rates. Remember, your communication objectives should support the overall EPI objectives. Now, identify your strategies and activities. Your plan should include the 3 main types of strategies. Advocacy is intended to raise support and resources from community leaders and decision makers. Social mobilization aims to secure community-based support, participation, and ownership of immunization activities. Finally, social and behavioral change communication aims to promote knowledge and positive attitudes about immunization practices at the individual and community level. As you plan your strategies and activities, choose monitoring indicators to track the implementation and progress towards your objectives. Ask, how will you measure progress towards the targets you have set for your objectives? For each target, select an indicator that will help measure your progress. Your district may have a target of holding planning meetings with community members every 2 months in villages with low coverage rates. The indicator for this target would be the proportion of villages with low coverage that held planning meetings in the last 2 months. Next, identify resources. Be sure you consider human, material, and financial resources for each activity at each level. What staff or volunteers will be needed? How much time will it take them to carry out these activities? What materials will be needed for education or promotion? What additional costs will there be for travel, training, or advocacy? Finally, develop a work plan. Ask, how will we carry out each activity? The work plan should include a description of each activity along with the target audience for each activity, the resources needed, who is responsible for each activity, and a timeline for when each activity will occur. Be sure to include monitoring and evaluation activities into your work plan to ensure that your communication activities are implemented as planned. Before implementation, disseminate the plan to all levels within the health system, including facility managers and health workers who may be responsible for implementing some of the activities. Also, share the plan with stakeholders and community leaders. Now you know the general steps for developing a communication plan.